up? Coach Tiff here from Beyond RCM Revenue Cycle Management. On July 19th, which is this Saturday at 10 a.m., I want to invite you to my live stream, The Big Beautiful Breakdown, Understanding the Medicaid Payer in the United States of America. This live stream is going to be broadcasted on 3 different platforms: YouTube, LinkedIn, and Instagram. Whether you're someone who's working in the medical field and you want to deepen your knowledge of the Medicaid payer system, how it's structured, and how all of these new changes that have been enacted with the President's Big Beautiful Bill is going to impact the Medicaid payer system, this live stream is for you. If you are someone who is currently on Medicaid and you want to better understand how these changes are going to affect your coverage, this live stream is for you. If you are a medical provider and you see a high volume of Medicaid or managed care patients, this live stream is for you. So I want to invite you to join me this Saturday at 10 a.m. Eastern Standard Time. I'm going to leave all of the links in the description. See you there. I want to take a moment to spotlight an organization that I think is doing really great work in the healthcare space. Now, a couple months ago, we were a little bit on pins and needles in the medical industry because we didn't know if telemedicine access, the way we know it currently, was going to come to an end. Telehealth previously was offered in a very limited structure, and with the COVID-19 pandemic, the whole concept of telehealth exploded, and with it became a tremendous opportunity for individuals to get access to care. Now that the pandemic is in the rearview mirror, we do need to address what telemedicine is going to look like going forward in the United States of America. So far, what we are seeing is there's not been a final determination. What we've been seeing is that the concept of telemedicine keeps getting punted out several months, and ultimately we need to know what the final resolution is going to be. But when we were uncertain a couple months ago, this amazing colleague of mine reached out to me on LinkedIn. Her name is Christy Stevens, and she made me aware of an organization that she partners with called ConnectMD. And what ConnectMD does is they are a virtual medicine concierge service. They are not an insurance company. And the way their organization works is they provide access to care for individuals in need of primary care, wellness care, certain specialty services. They are able to also provide access to prescriptions in certain scenarios, and they're also able to provide mental health services. And these services are provided at a very low cost. Plans start at $60 and they range all the way up to $100. And these plans are available not only for U.S. citizens, but individuals who may not be citizens in the United States of America, but they have a medical issue that they need access to quality care on. Now, it is very important to note that in the United States, there are roughly about 25 million citizens who do not have access to medical care. So I'm not even talking about individuals who are not American citizens. We're talking about American citizens under the age of 65 that do not have access to quality health care. And while the ACA was introduced, oh my goodness, like over a decade ago, and I can't even believe it's been that long, and the intention of the ACA was to address the need of Americans having access to care, there are many challenges with the ACA. The biggest challenge with the Affordable Care Act is the fact that it can be quite costly. Not only are you going into the marketplace and purchasing insurance that you're going to need to pay a monthly premium on, but you're also in many instances going to need to meet an out-of-pocket deductible or co-insurance before your insurance company is even going to start paying any of your services 100%. So many individuals working who do not qualify for Medicaid, they don't find the ACA as a viable option because it's just too expensive. That is where organizations like ConnectMD can fill the need, providing access to care for those who need it. So again, I'm going to send some information in the description of my channel. I'm going to leave some information in the description of today's video. And I encourage you to go and check out the work that they are doing. And if you are interested in applying for coverage through ConnectMD, you can apply for an individual policy, or you can also, as an employer, apply to give access to your employees. And we know that with everything going on right now, especially with Medicaid being a top item on our president's big, beautiful bill, we know that cuts to Medicaid will likely result in less expansion of Medicaid and will likely put even more individuals out of the realm of having access to healthcare insurance. And that's why organizations like ConnectMD are so important, so that individuals are able to get the access to care that they need. So again, I'm going to put that information in the description. I encourage you to check out their info. Christy is an approved broker of ConnectMD, so feel free to reach out to her directly if you are interested in learning more about this coverage. And that is going to wrap up this month's monthly Roundup/vlog. Thank you so much for taking the time to hang out with me this month. If you have not done so already, please do not forget to like, subscribe, and hit the notification bell. And I can't wait to see you in our next video. Until then, peace out and God bless.